name's Michelle. I'm going to be your nurse today. Can I just get your name and date of birth?
Mary Smith, 10/20/52.
Perfect, and that's what I'm seeing here on your bracelet. And so I do have doctor's orders today to insert an NG tube into your stomach. And basically it's going to be a tube that starts in your nose and it goes into your stomach, and that will be used for like feedings and to administer medications. Is that going to be okay with you?
I think that sounds great.
All right, let me just get some hand hygiene done.
Okay.
All right, and then I am going to assess your vitals. Let me move this bed up to my position so that I can more easily access everything. All right, perfect. And then for this process, we are going to put you up all the way forward, and that's called the high Fowlers.
Okay.
It just wants to bend your legs. That's okay. We'll put it back down. There we go. All right, and then I'm just going to go ahead and listen to your lung sounds, and I'm going to apply a pulse ox to your hand here. Your lungs sound good. Your vitals look good. Are you in any pain?
No.
All right, perfect. On a scale of 0 to 10?
0.
Okay, and then you don't have any allergies, do you?
I do not.
All right, not that that really applies, but it's important to ask. All right, hand hygiene again, and then I'm going to just apply some gloves here. All right, and then I'm going to grab my tongue depressor, and I'm just going to check your gag reflexes really quick. And then can you cough for me? Perfect. And then I'm also going to check the patency of your nostrils. You can just breathe out for me. All right, everything looks good there. And then this is just going to go right there into your left nostril, okay? Give me just a second. I'm going to prepare the tube for you, okay?
Okay.
All right, and so during this process, as I stick the tube in, I'm just going to have you take a couple sips of water. That'll help to close the epiglottis so that it just goes straight into your stomach instead of into your airway, okay?
Okay.
All right. Put the loop here. Perfect. And then I'm going to measure the tubing. And that's going to start from your ear to your nose here. And then it's also going to go from your nose down to your xiphoid process. And then with that, I'm going to take and measure right below that and hold it with a piece of tape so that we don't insert any further than that measurement, okay?
Okay.
There we go. All right, and then I'm just going to apply the lube so that it has easier entry. All right, and then I'm going to start to insert it, and then you just go ahead and take those sips, okay?
Okay.
All right, sip, sip, sip. And then right when it hits to the back of your throat, I'm going to tip your head forward, keep sipping. Perfect. When it's about 10 inches in, I'm going to make sure there's no air coming through, so make sure it went to your stomach. Perfect. We're going to keep inserting quickly, 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 but gently. Perfect. Very good. Are you in any pain or discomfort?
No.
All right. And then I'm just going to secure this to the side of your face really quick.
Okay.
And then I'm going to check the back of your throat to make sure that it did get where we wanted it to go, okay? So I'm just gonna tape that to your cheek. Doesn't stay very well, so I do apologize for that. There we go. Stay on there. Okay, well, it's not sticking to your cheek, but I'm verbalizing that it is stuck to her cheek. And then I'm just going to use my pen light, look in the back of your throat, make sure it went down all the way. Looks very good. Alright, and then next thing I'm going to do is I'm just going to attach and secure it to your nose. By doing so, I'll grab a piece of tape and I will split it down so that there are 2 equal sides. And that's just going to wrap around the tubing, okay? You still doing okay?
Yeah.
Good. So this would just stick to the bridge of your nose. And then the 2 side pieces will just wrap and secure the rest of the tubing. And then before I did that, before I put that tape on, I would have put an adhesive, or the adhesive gel to stick that better to your nose, but it'll stay on there just fine.
Okay.
Alrighty, and then at this point, I will clamp your tubing, and I will, and then I'm going to remove my gloves, and I'm going to perform hand hygiene. I'm going to lower your bed, and then I'm going to put in an order to have an abdominal x-ray done to make sure that we have that placed properly, okay?
Okay.
Now, are you comfortable? Do you want your head back?
I'm okay.
Okay. So leave it there, and then I'll put your call light here, and then if you need anything, you let me know, okay?
Okay.
I'll be
thank
back
you.
in shortly just to check the stomach contents and the pH levels, okay?
Okay.
All right, thank you. Go out.
Hello.
Hi, I'm back. Can I get your name and date of birth?
Mary Smith, 10/20/52.
Perfect. And then I am your nurse, and my name is Michelle, and I'm going to be just checking, like we said earlier, the pH of your stomach juices, okay?
Okay.
All right. And then are you in any pain?
No.
Are you feeling nauseous at all?
No.
All right. I'm going to raise your bed up so that you're a little bit closer to me. There we go. We got your pull socks on still, so that's good. I'm going to perform hand hygiene. I am going to put a new set of gloves on. All right. Alright, and so basically with this, we're just gonna draw a little bit of the contents of your stomach fluids, and before that we're gonna insert a little bit of air, then I will pull it back, and then per the doctor's orders, that's what we're gonna do. Is that gonna be okay with you?
Yes.
Okay. Alright, and then let's see here. I'm just going to set this stuff here for me. And then if it's okay with you, I'm just gonna lean you back. I just gotta listen to your bowel sounds, okay?
Okay.
Alright. There we go. Does that feel okay?
I think so.
Alright, I'm gonna just pull up your gown a little bit so I can hear a little bit better, okay?
Okay.
Alrighty. Alright, and I'll be listening to all 4 collagens just to make sure that your bowel sounds are active. Alright, bowel sounds are active in all 4 quadrants. So that's good. All right, and then, so like I said, I'm just going to take this right here and I'm going to, unclamp you. And first I'm going to draw 10, set that to the side. I'm gonna draw, 10 milliliters of air. And then flush the tube with that. And then I'm gonna pull back 5 to 10 of the juices. Reclamp it. I'm gonna mix it around. There we go. And then I'm going to put the fluids into here, into here. And then we're just gonna check the pH level, okay?
Okay.
Stick that there. Alright. Stick the stick in for a minute. Perfect. And then I'm just gonna compare it to here. Looks like your center contents are within the correct levels of pH. And then I'm gonna draw back 10 milliliters of fluid per my facility policy. And then we're just going to go ahead and flush your tubing with that, okay? Okay. Alright. Slowly inserted that, and then I'm going to reclamp it. Set that aside. And then, are you feeling any discomfort? Are you feeling okay?
I'm okay.
Alright. I'm just going to lower your bed. And then is your head in a good position?
I think so.
Alright. Alright, I will remove my gloves. Perform hand hygiene. Clean up my area. And then hand hygiene. And then I will give you your call light, and then I'll be back just in a little bit to check on you, okay?
Okay.
Alright, thank you. Wait a minute. Hi, I'm Michelle. I'm going to be your nurse again. So I was just in earlier, but we do now have a doctor's order to remove your NG tube. Can you just verify your name and date of birth for me?
Mary Smith, 8/2/52.
Looks good on your wristband there. And then with the removal of the NG tube, what I'll have you do is when I start to remove the tubing, I will have you take in a deep breath and hold it, and then we'll pull out slowly. And you shouldn't feel too much discomfort, but there might be a little bit there just as it's removing from your nose, okay?
Okay.
All right, and I'm gonna just raise your bed up a bit. Your vitals all look good. We've stopped the suctioning or the insertion of any medications. Your tubing is clamped. And then I'm going to perform hand hygiene, and I'm going to put gloves on, and then we're just going to put a towel over just in case when we pull out the tubing, anything gets on your gown. We don't want that, okay?
Okay. Thank you.
Absolutely. All right, and just cover you up with this. All right, and then I would remove the tape from your face. This would have been pinned to your shirt, so I would remove that so that it's easier to pull out. And then I'm going to put you in a semi to high Fowler position. I'll put you up a little bit further here. Dripping a little bit. And then I'm just going to remove it, okay? I'm going to remove the tape from the nose here. And then take a deep breath in for me.
Okay.
And then hold it. Okay, go ahead and breathe normal. Are you feeling okay?
I'm okay.
Alright, are you in any pain?
No.
And then I would just wrap this in my glove and dispose of that. I perform hand hygiene. Put new gloves on. Alright, and then do you need a tissue or a drink of water?
I think I'm okay.
Alright, I'm just gonna wipe your face a little bit here and remove this, okay?
Okay.
Alright, and then I would reassess your vitals. It looks like everything's good. I'm gonna remove the pulse oximeter now. Put that away. I would clean up my area. Dispose of everything that I do not need. And then I'm gonna lower the bed into a good position for you. And then it looks like your head's a little bit forward. Would you like me to lean you back a little bit?
Yes, please.
Perfect. Is that good?
That's good, thank you.
Yeah, you are very welcome. And you're not in any pain, right?
Nope.
All right. Well, I'm going to give you your call light here. Perform hand hygiene. And then if you need anything, you just let me know, okay?
Okay, thank you.
Thank you. Have a good day.
You too.